come in.
Good morning, Jenny.
Good morning.
This is Christy, your nurse. I have Tiffany here. She's going to be your nurse for today. She'll be with you until 7:30, okay?
Okay.
Oh,
Good morning. May I touch your arm?
Sure.
All right. How are you this morning?
Fine, thank you.
Good.
this is Crystal, her daughter. She's going to be
morning.
with you today, okay? Is it okay if we speak in front of your daughter?
Oh, absolutely.
Okay. All right. So this is Jenny Jones. She's an 85-year-old. She came in 2 days ago on the 23rd to the ER for increased shortness of breath and fever of 101.2. She was diagnosed with community-acquired pneumonia.
Okay.
Her primary doctor is Dr. Smith, the hospitalist. She does have pulmonology, Dr. Lung on the case, and respiratory. She's getting respiratory treatments every 6 hours. Her vitals this morning at 6 a.m., 114/72, heart rate of 85, temperature is 98.8, oxygen saturation is 95% on 2 liters of oxygen via nasal cannula. She is AccuCheck's AC and HS. Last AccuCheck for me at 6 a.m. was 120. She is getting Percocet every 4 hours. I last medicated her this morning at 6 for a pain level of 6 out of 10. Her next dose is at 10 a.m. Jenny, can you tell me what your pain level is now?
It's about a 4.
A 4. And is your goal still 3 where it's a functional level of pain for you?
Yes.
Okay, good.
I'm going to update your board.
Perfect. Okay, Jenny is a full code. She has no known drug allergies. Past medical history, pneumonia in 2014, emphysema, diabetes mellitus type 2. Jenny has been blind for the past 5 years due to diabetic neuropathy. Past surgical history, she had a hysterectomy at age 60, and she's a retired school teacher. She lives at home with her husband. He was unable to be here today. She does have a chest x-ray scheduled today at 10 a.m. Is it going to be okay if you go by wheelchair, or would you prefer to go by the bed today?
I would rather go by wheelchair.
Okay, we'll call them and let them know.
Thank you.
Also, lab tests. We have the CBC that was ordered this morning. The white blood cell count yesterday was 12,000.
Excuse me.
Uh-huh.
What's that mean?
The 12,000, so your white blood cell count's a little elevated, which is seen with infection, which can be coming from your pneumonia. But the antibiotics we're giving you will help decrease that count, so that's why we're monitoring it, okay?
Okay.
All right. She's been alert and oriented for me. Cardiac's within normal limits. Her lungs are decreased in the bases bilaterally. She has a non-productive cough. She has aspiration precautions ordered with the head of bed greater than 30. Urine output for the last 6 hours of my shift, she had 360. So we've been over 60 mLs an hour.
Is that good or bad?
Yep, we want anything over 30 is what we're looking for, and you've been about 60 an hour.
Okay.
Okay. Last bowel movement was 2 days ago on the 23rd. Bowel sounds are active in all 4 quadrants. Skin's within normal limits. Her Braden score for me was 20. Her fall score was a 45. She's just an assist times 1.
Okay.
She does have her bed alarm on. Her IV site is a 20 in the left forearm, dated the 23rd. She has normal saline at 85 cc's an hour.
Okay.
She's getting Ansef 2 grams twice a day, scheduled for you at 9 a.m. Her DVT score was a 3, so she's getting Lovenox twice a day.
Okay.
Let's see, my recommendations for the day: to check that white blood cell count when it's resulted in the chest x-ray.
So we're going to update your communication board. Remember, this is a board that all members of your care team use: hospitalists, physicians, nurses, the CNAs, the physical therapists, and we encourage your family to use it as well to interact and utilize as part of your care plan. Caitlin is our team lead today. She's a head nurse on the unit that if anything comes up that I'm unable to help you with, you can use her as a resource.
Okay.
And I'm your nurse, Tiffany, again. Bob is our nursing assistant. So he'll be helping us with vitals and helping you to the restroom, helping you to ambulate, I can do that as well if you need me to. We have your physicians up here, Dr. Smith and Dr. Lung. We'll update your board when we get your bath and your linens changed today. Our goals for going home is to titrate you off oxygen. You don't wear any oxygen at home, do you?
At night.
Just at night? Okay.
Perfect.
And then, Crystal, I have your phone number on the board. Is this still a good phone number?
That is correct.
Would you like to add your husband's phone number, or would you like Crystal to be our primary contact?
I'd rather have Crystal be my primary.
And you were interested, you wanted a call with the results of the chest x-ray,
Yes.
correct? So I'm just going to put a little note for the doctor to give you a
Perfect.
call. Alright, we have you on a regular diet, and it looks like you're still receiving ANSEF, which is the antibiotic. Some side effects could be an itching or a rash. And I'm going to add your Lovenox on here too. That's the shot
I
we've
didn't
been-
hear you.
I'm going to add the Lovenox on the board as well. Some
Okay.
side effects of that can be bruising and bleeding.
Okay.
At the little bit of bruising or bleeding at the injection site. Is being seen often still going to make this day a great experience, or is there anything else you'd like to add?
That's perfect.
Okay. So our lab test today were your complete blood count, which we talked about, that monitors your white blood cells.
Right.
And then we also have your chest x-ray where we'll take a look at your lungs.
Okay.
I see you've already done your oral care where you've cleaned your mouth this morning once.
Yes, I did.
Oh, good. And our goal for today is to get that oxygen off?
Yes.
Okay. I'm going to update your hourly rounding, and I'm going to put my initials here in the day shift. So I will be around at least once an hour to check on things like pain, make sure that you're comfortable with your position in bed, make sure that all of your personal items are within your reach, and also see if you need to do things like use the restroom or go for a walk.
Okay.
Okay. I see that Christy medicated you at 6 with your Percocet, so you can have that again at 10. Now I'll check on you a few minutes prior if that's okay to see how you're doing and see if you're going to need that.
I really appreciate
Okay.
that.
So, Jenny, do you mind now if we do a quick assessment and I look at your IV and your oxygen and your skin?
Oh,
Okay. Do you need size small?
Yes, please.
There you go.
All right. Jenny, we're going to come over and take a look at your IV site to your left arm, okay?
okay.
All right.
You guys need me to move out of the way.
Yes,
Okay.
please. If you could.
Thank
I'm
you.
going to be right over here, okay?
All right. Thank you.
Jenny, can we touch your left arm here so we can check your IV site assessment?
IV looks
Okay.
good.
20 gauge. You have normal saline running at 85.
Okay.
This is your ANSEP. This tubing's good for your shift today.
Okay. I'm going to check the computer.
Okay.
Perfect. Everything
Okay.
looks great.
Your bed alarm is on here.
Okay.
Okay. Your oxygen is at 2 liters via nasal cannula.
Okay.
Okay. Jenny, I'm just going to walk around to your right side, okay, and I'll go over your bedside table with you and get everything in a better position.
Okay.
Okay, Jenny, I'm just going to move your table. I have your call light here at 6 o'clock for you. Your water's going to be about 7 o'clock.
Okay.
Okay, your incentive spirometer about 9 o'clock. Is that okay?
Okay.
So within reach. Your oral care, I'm going to move over here to about 3. Okay, all right. And your tissues at 12 o'clock, right up top. There you
Would
go.
it be easier for you to reach your tissues if I put them on your left side?
I would rather have
Yeah, let's get those over
because I
there.
use a lot of them.
And I have your
Put them
phone.
right here next to you.
Jenny, I have your phone. Where would you like that at?
Right here on my.
Okay, there you go. Okay, let's go over your call light one more time here with Tiffany. Perfect. Okay, so right up top where you feel your braille is going to be your call light. Okay, that's the nurse call light. If you need anything emergent or urgent and we're not in here, go ahead and give us a call. And that big button you feel there in the middle, to the left of that is going to be your volume for your TV. To the right of that is going to be your channels.
Okay.
Okay, And we'll put that back at 6 o'clock for you. And your incentive spirometer, here it is. I'm going to have you show Tiffany you know how to use it, okay?
Okay.
Jenny, do you
Okay.
remember what your incentive spirometer is used for?
To expand my lungs,
Okay.
Yep.
and I breathe it in.
Okay.
Help keeps those lungs healthy.
Deep breath.
Perfect. Good.
And do you remember how many times an hour we'd like you to use your incentive spirometer?
You said 10. That seems like a lot.
Yep.
It's very important, especially with your pneumonia, that you use it frequently to help open up your lungs, expand
Okay.
them, and it'll help improve your condition.
Okay.
Okay.
Do you need to use the restroom before we go?
Oh,
Are you comfortable? Do you need help repositioning?
oh.
All right, Jenny, have a good morning. Thanks for letting me take
Well,
care of you.
Thank you.
All right.
Thank you.
Tiffany's
You
going
are
to take great
welcome.
care of you.
And I will be back shortly, probably within the hour.
Oh, good.
Okay. If you need anything urgent or emergent in the meantime, just let me know.
I will.
All
Thank you.
right. Thank
All right.
you.
Have a great shift. Thank you.